have a quick question for the doctors again. It's again a cliche kind of question, but very critical. In this whole thing, patient awareness or awareness of the public is very important. I think Santosh, you already touched base on that, and it is sometimes a boring job, but a boring necessity. So, any quick take on that, Santosh and Harsha? About the importance of patient awareness and how digital and such techniques can be useful, because that will finally drive your business also and the way healthcare moves forward post-corona. Patient awareness, generation, increase.
So, I mean, from a patient awareness point of view, if you ask me, as general customers, they are exposed to a lot of digital already in the other industries, whether it is banking, whether it is hospitality, and so many other things. So, from the hospitality aspect of the provider, there is already a set expectation. Today we have patients coming and asking us, why can't I book my appointments online? Why can't I book my patient room online? So there is already a lot of awareness from that point of view. What we need to see is, how do we build in the clinical aspects of things into that? And that is where, what Mr. Dam also mentioned, we have to get to a stage, whether it is wearables, whether it is point of care devices, some of those things and how they can get integrated into the whole patient care ecosystem. I think that's one aspect that we need to really work on. That awareness is going up. So now everyone has got pulse oximeters now, and they're conveniently pushing data to physicians so that we can manage them at home. But it can easily go up to the next level of glucometers and so many other devices where digitally physicians can conveniently monitor them. Today we've got the halters where patients have halters and our cardiologists over here are conveniently monitoring them, and the moment something goes out of rhythm, immediately there are alerts which come to us. And so much of this can be extended elsewhere. And like what Mr. Thakur also mentioned, we are using this at a shallow level, but a lot of work can be done on the clinical decision support system. I think there's so much of work that can be done in critical care units where very proactively the systems can prompt that this is an ICU patient where based on the previous data, he is most likely to end up in a stroke if certain interventions are not done. Those are some of the things that can easily be built in. I mean, areas like digital pathology that we are implementing, digital radiology, those are areas that can a lot of work can be done from a patient awareness point of view. So overall, on the clinical side, I think there is work to be done, and we need to create that awareness. On the patient experience aspect, I think as providers, we need to do more work.
Sure. Thank you. I think, so therefore from all of you, what I hear is, healthcare is complex. You have the patient at one end, then hospital, home care, and you go behind, you end up with so many stakeholders, medtech, devices, equipment. Possibly what the pandemic will do is to force the ecosystem to go in the direction of integrated healthcare. And that will possibly, cut a lot of wastes also, because wastes are there. Asset management is an issue in healthcare. So I think possibly the digital will ensure that healthcare becomes more integrated in terms of healthcare delivery. Before I go to Amira, I'm alerting you few seconds in advance. I thought it was most appropriate. You are the most appropriate person for me to ask a bit about the government-private part. But I'll just look for Harsha's quick opinion on the same topic that Santosh commented on. Do you have anything to add to that, Dr. Rajaram? On the integrated model or patient engagement?
Yeah, I think, right now, to add to what Dr. Santosh said, I think right now the digital platform has been more of transactional. Though patients have been very much, used to WhatsApp and the other digital, but the difference between healthcare and the other commodities or other platforms are that this is not a compulsive need, or it's not a wishful motive for them to be on a platform. So definitely, I think there has to be sufficient motive and incentive for them to be drawn towards the platform, and also thereafter engaging with them. So this could be in the form of financials, or I think the most important influencer is doctor himself. For a patient, doctor has always been the biggest influence. I think if the doctor can promote digital space to the patient, I think the adoption would be wonderful.